My name is Nat Kendall Taylor, and I'm the CEO at the Frameworks Institute. So the way that I think about framing and explain what it is that framing, the science of framing, the study of framing, is really the investigation of how the choices that we make as communicators influence, have an effect on the way that people think, feel, and are willing to act based on the information that we communicate. So framing, in essence, is about the way that varying the way that we present information has effects, impacts, and influences on those who are receiving and those who we are communicating with. Framing is a fundamental tool, it's a fundamental part of social change work because of the fact that public opinion and public will and people matter when it comes to social issues in democracies. So a big part of the job of an issue advocate, of an expert working on a particular issue, is creating the kind of groundswell of public opinion, of public demand that'll create space and allows policymakers, if not puts pressure on them, to actually do different things in their role as policymakers, to create kind of a tide of public opinion that can move an issue forward in a more productive direction towards solutions that can actually improve the issue. So framing is a way of fomenting, of gathering that public opinion and of allowing advocates to kind of harness or ride that wave of public opinion towards the kind of policy and practice changes that they know need to be achieved if an issue is to be addressed. So at Frameworks for a long time, I'd say about 5 years now, since probably almost 2010, I have had a running list of issues that are in dire need of being reframed and that I would really like our organization to work on. And in the United States, the issue of foster care, what has a different name here in Scotland, I know people with care experience or people in the system of care, has been 2 or 3 on that list. And I think the reason that it's such an important and, for a framing researcher, exciting and important issue to work on is that I think it's one of these social issues that we experience where public understanding or lack of public understanding or public misunderstanding of the issue, the system, and those involved is such a strong barrier and impediment to enacting, designing, implementing the kind of policy change that is required to better support this group of people and our society more generally. So when this issue came along, I probably got more excited than I would like to admit and was quite eager to take the methodology that we use at Frameworks, which is about understanding public thinking and designing and testing strategies that create space for people to think about issues in new and different ways. It was just incredibly exciting to take that process and use it in a place like Scotland where there's lots of exciting things going on an issue that I have had my sights set on for quite a while. So incredibly excited about being able to do this project here in Scotland. In the UK right now, Frameworks is engaged on a number of different social issue reframing projects. And the interesting thing is they all kind of fit together with some commonalities into an issue envelope. So we've been doing work for about 3 or 4 years now on reframing crime and justice policy in the UK. We're working right now on a really exciting and cool piece of work on reframing poverty. We're doing some related work on kind of how to talk and present information about the economy and how it works in order to reframe an important part of the public discussion. And I think that those projects, together with work we're doing, for example, on homelessness and work we're about to begin on what in the field of public health is called the social determinants of health, so the non-individual factors that shape a population or an individual's health, has those projects come together to have, and I like to think this is intentionally, are coming together to have this really nice synergy between them where the different groups who are involved in each of the projects have the ability or the potential to benefit from all of the other projects that are being done. So you can imagine, and we're working directly and explicitly on doing this, that the people who are working on justice, crime and justice policy, will be able to take what comes out of the poverty work and be able to use that as part of their story. The people who are working on poverty are going to be able to take the work on homelessness and use that as part of their kind of sector narrative and building more public will and understanding of their issues. So we're working on a really exciting mix of projects right now, and I think the challenge, and it's a good challenge, it's a really an interesting challenge, and one I think we can meet, is how, as these projects continue to move along, we're able to bring different people together to tell some of the same stories and share each other's frames across issues. And I think that, as someone who studies culture and the way that culture changes, I think it's that kind of cross-issue synergy that is incredibly powerful, and quite frankly, I think the only way that culture on these issues is going to change in meaningful ways. In the work that we're doing on care-experienced young people, care-experienced youth, there's a number of different questions and stages of the larger process, of the larger project, and I like to think of them all in terms of stories that we're trying to figure out, stories that we're doing research on. And the first story that we're investigating is people who work in this sector, people who work with, people who study the system of care and those who have experience in it. What is the story that they want to be able to tell? What are the ideas, the core principles that they want people outside of this system, among the general public, policymakers, to understand about this system and how it works? So that's the first stage, the story that you want to tell. The second stage is in actually interviewing members of the general public, figuring out what are the stories that people tell themselves about this system and those people who are and have been involved in it. The third stage, the third kind of story question, is what are the stories that are currently being told? So what are the frames and the stories that people are exposed to as they turn on the news, as they talk with friends and colleagues, as they are, interestingly, importantly, exposed to messages that actually come from the sector. So that will give us a really good sense, those three questions, of what is the kind of current context of public thinking and understanding and messaging about the issue. And then the fourth question, really importantly, which is where we get into reframing, is what is the story you should be telling? What is a new way of talking about this issue? What are new frames to use, different ways of kind of constructing our communications that allow people to kind of access new information, think about this issue in dramatically new ways, have space to consider and engage in the debates that we want people to be engaged in. And I think last but not least, and as the researcher, this final question is the absolute hardest question. But how can you actually get people who should be to tell this new story? How can you get enough of the story to come from the right people, through the right channels, to a wide enough group of the public and various parts of the public to actually shift and change the way that people think about the care system and those who have experience with it?